Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the FIA Group.
Welcome to another episode of Empowering Plans. Today with me, as always, is Kevin Brady, along with myself, Kelly Dempsey, and we're going to talk about, by request, our Handbook Gap Review service. So this is something that we've been offering. I like to say it's a newer gap review service, but it's definitely been around for more years than I care to admit at this point. It's probably getting up to like the 7-8-year-old mark. But we're going to go over what the Handbook Gap Review service is, how it came to be, why it's important, and why it's even more important now as things are changing in the industry and the United States and all the fun things related to health plan administration and employer policies. So I'll turn it over to Kevin to talk a little bit about what the Handbook Gap Review service is, kind of the methodology behind it, and then I'll dig into some case studies.
Yeah, very exciting stuff. So just talking about, as Kelly mentioned, our Handbook Gap Review service. So when we're thinking about a handbook, that's going to be a compilation of employer policies. Sometimes it's really neat and pretty. It's bundled up in a spiral notebook and it says employer handbook right there. And it's really nice and easy to read. Other times it's going to be a compilation of documents that are kind of sporadic and spread out where you need to go in a couple different directions to find exactly what you're looking for. When it comes to our service, what we're doing is we're taking a look at the relevant plan document SPD, and we're comparing it against that handbook, or like I said, that compilation of other documents that, put together become the employer handbook. And what we're doing with these reviews is we're taking a look at both of those documents, and we're specifically looking for a couple different areas. Mainly what we focus on is eligibility. We have leave of absence policies, and then we have continuation of coverage as well. Those are going to be really the three big things that have that crossover between the plan document and then the employer handbook as well. When we're looking at it, we're looking at a couple of different laws too. So FMLA, the ACA, USERRA, ADA, all of these things are coming into play. And a lot of times they're going to be the types of laws that will appear in both of those documents. Looking specifically at these documents here, what we want to do is we want to identify, first of all, whether that information exists. So is there any reference to eligibility? Is there references to leave of absence policies, any of those things? We want to find out in both of those documents if that information exists. And then further, if it exists in both documents, are those things consistent? Because the last thing you want is a contradiction between the employer handbook and the plan document, summary plan description. Then people are looking at both of those documents, they're reading them, they don't understand what's what. And you really want to have one source of truth, or at least you want to have consistency between those documents. So one good example would be if you have eligibility provisions that are laid out in both, and we're going to actually have a pretty good case study on that later on. But if you've got the eligibility provisions for health plan coverage in both the handbook and the plan document, maybe one mentions a waiting period and the other one doesn't. What do you rely on? What's the source of truth? And at the end of the day, it's really going to depend on, who's looking at it, right? If a stop loss carrier, they're not going to really worry too much about maybe what the handbook says. They're going to be focused on the plan document. But if you're an everyday employee and you're looking at your handbook, maybe you have a different opinion. So it's always important to not only address whether these examples, from FMLA, ACA, USERRA, et cetera, continuation of coverage, all that stuff. It's really important to think about whether that information is in both of those documents, but also that they're consistent between each other. In addition to looking at those kind of, high level things in terms of eligibility, leave of absence, and continuation of coverage, we also look at the document in terms of leave laws in each state. So as we'll talk about a little bit later on, every state's going to have their own kind of way of going about, laying out leave laws, how employers have to treat their employees. What we do is we take a look at both the handbook and the plan document, and we determine whether those things are satisfied, whether it addresses any kind of leave laws that might be relevant in a specific state. And then further, whether the document itself, the plan document, outlines whether coverage is continued. So that's really important because, not every leave is always considered in a handbook. Not every leave is considered in the plan document, not saying that it has to be. But at the same time, if that leave is available and there's going to be continuation of coverage, that's something that really needs to be outlined in the plan document. And then our approach here is generally we're going to focus on, wherever the employer is domiciled. So wherever their principal place of business might be. And then from there, as we'll go into a little bit later in more detail, there's a lot of other states that might come into play. Our employers have a lot of people that are across the country now. They're in different states. And that kind of brings about other state leave requirements or other state laws that might be relevant. So what we do is we focus, like I said, on where the employer is domiciled. Then we also can review other state laws to make sure that state leave laws are incorporated into the handbook, whether that's through like an addendum or something like that. But we really go in to make sure that everything is outlined in those documents. And like I said, that there's consistency between them. So not only, I kind of already went over the fact that, identifying whether that information is there, identifying whether state leave laws might be relevant in a handbook or the plan document in terms of whether leave is continued. All of those things are always important. And then consistency between those documents is really going to be the number one thing. So our handbook gap review is a really thorough analysis of both of those documents in terms of how they compare against each other. And it can really do a good job of highlighting where either information is missing or even maybe a worst case, information is inconsistent across those documents. So I think it's important also to give a little bit of context on why the handbook gap review came into place and why we offer it as a service now. And Kelly's got a couple really, really interesting case studies that really do a good job of showing why we offer this service and why it came up in the first place.
Thanks, Kevin. So yes, I can actually go back to probably the first two fact-specific situations that we had that caused us to say, what can we do to help our clients? What can we do to help TPAs and stop-loss carriers or whoever else comes to us and asks for help? How can we help them to get out of these situations? What can we do proactively? And that is the idea behind these gap reviews, including our handbook gap review, is that they're done proactively, hopefully to identify issues and resolve them before they actually become a problem. So the first case study was really centered around a misinterpretation of the applicable law related to the employer as well as the health plan. So it was a situation where the stop-loss carrier actually came to us and was asking for help because they were, having discussions with an employer and their TPA about this individual that was on a plan that had exhausted FMLA. So there was no more FMLA, but the person was still on the plan and they were out due to a medical issue. They were incurring medical claims while they were out. And the employer specifically said, we're doing what we're required to do under the Americans with Disabilities Act, so the ADA, that we are required to offer this reasonable accommodation, which in this situation is a leave of absence. And since this person is having medical issues, we're keeping them on the plan. And that was great, except for the fact that that is not really how the ADA works. So FMLA requires that continuation of coverage as if somebody is still actively working. But the ADA, the Americans with Disabilities Act, does not have that requirement. It does say that there needs to be a reasonable accommodation, and a reasonable accommodation may be a leave of absence, but it does not actually have that continuation of coverage requirement. So in this situation, the employer, again, was completely misinterpreting the law due to I believe it was a Supreme Court case that's a little bit older now at this point, but it was a pretty hot topic, big case historically related to a leave of absence where the individual was pregnant and the employer at that situation failed to offer a reasonable accommodation, which was a leave of absence in that situation because of lifting restrictions and so on and so forth. So in that situation, I actually do believe, if I recall correctly, that neither the handbook nor the plan document supported this continuation of coverage or this leave of absence other than to reference the Americans with Disabilities Act. So it was just a very loose reference. So again, in this situation, the plan, the employer, stop loss are all bound by different rules and regulations. And again, in this case, the employer just, made a wrong assumption regarding the applicable law to continue coverage during ADA. I mean, it is kind of counterintuitive to not have to continue coverage if somebody's out on a leave of absence because of a medical issue, but that's just not what the law supports right now. So if an employer wants to continue coverage for somebody that is on a leave of absence due to a reasonable accommodation under the ADA, their plan document would need language to support that, as well as their handbook. You might be saying, well, Kelly, FIA always tells us not to have duplicative information across documents. So why are you telling me to have language in the handbook and language in the plan document? Because unfortunately, in this situation, they serve two different purposes. And they're required from an employer perspective to have this employer handbook and have the documentation of their employer policies. But you're also required to have the SPD plan document, summary plan description, that outlines what's required under the plan. And in this case, the employer and the plan want the same thing. So yes, it is going to be a little duplicative between the documents, but it's because the documents are meant for different purposes. So it's crucial in this situation that both documents support what the employer is trying to do and what the plan wants to do, and that they obviously don't conflict. So this is one of those reasons why we suggest an annual review of the plan document as well as the handbook and these gap reviews, because if you do them on a regular basis, you can find an issue spot if there are situations. But that is one of the things that we as FIA do as an employer, is that we review our plan document and our handbook at the same time of the year. So we always do it before our plan renewal, which we are a 1/1 renewal, like a lot of employers and plans in the industry. So we review everything starting probably like late Q3, early Q4 is where we start reviewing our handbook and our plan document. So that's one. The next case study kind of highlights the concept of the gap between the documents. So in this situation, the employer actually did have documentation in their handbook about continuations of coverage during leaves of absence, but stop loss would not accept the handbook as proof of eligibility because stop loss didn't have the opportunity prior to this situation arising to review the employer handbook. So they would only accept the SPD PD because that was what they had been provided. So while the handbook did support a continuation of coverage, the plan document did not. So the employer tried very hard to get the stop loss carrier to accept the handbook as the proof of eligibility, but they just wouldn't do it. So this is where a situation where if we had done the handbook gap review proactively, we could have identified that there was a gap between the documents and we could have better supported the plan and had changes to the plan language to support the situation. So the individual would have been covered not only by the plan, but as also by stop loss because of the issue. So kind of similar issues, but one was a misinterpretation of the law. The other was that they had it in the handbook, they just didn't have it in the plan document. And along with, I guess I'll throw in a third case study in this situation is that FIA actually as an employer over the last several years has really expanded into different states and different locations. So this is one of the things that we have had to do as an employer. And hopefully, Kevin, I'm not stealing your thunder, but this is one of the situations that we've had to take into account as having different employees in different locations, including Kevin and myself are in different states than where FIA is headquartered. So we've had to take those things into consideration. But I probably stole Kevin's thunder a little bit. So I'm going to turn it over to him to talk a little bit more about why handbook gap reviews are so relevant.
Yeah, seriously. Yeah, I think you took the wind out of my sails a little bit, but no, I'm just kidding. Exactly right. We are now in a position just, I think as an entire country where we've seen a kind of a proliferation of remote work or hybrid work. Either way, what we've seen is a lot of people expanding to different states. And in some scenarios, maybe some certain employers were used to having all of their employees in one location, one area. And that means one state to think about, state leave laws, anything like that. But seeing as there's more remote employees in more places, inevitably that just means that employers are going to have to start thinking about what is relevant in terms of state leave laws or, and really not even just leave laws, but just state laws related to employment in other states. So that's definitely something that's been changing ever since the COVID-19 pandemic. And I don't think that that's necessarily something that's going to change anytime soon. And really the big consideration there is that, each and every state has their own distinct laws. And those laws apply in certain situations, right? So if I am an employer and I have one employee that works in Illinois or Wisconsin, some other state, maybe certain leave laws or certain employment laws don't necessarily apply unless it meets a certain employee threshold. In other, situations, one employee is enough to kind of trigger those laws and everything like that. So it's always important to think about, what is the threshold? Is this law applicable to me as an employer? And do I have to make changes to my entire handbook? Do I do that on a state level, anything like that? So those are things that are really important to consider. As Kelly mentioned, here at the FIA Group, we've kind of experienced the same thing where, I'm in Illinois, Kelly's in Ohio. I'm not going to get more specific than that, Kelly, don't worry. And we have employees in other states as well. So in terms of the administration of our handbook, the plan document, continuation of coverage, those states need to be reviewed. The handbook needs to be updated and addressed to account for that. And that's not something that's unique to us. I think that's something that's really going on kind of across the country. And I think that's something that's going to be kind of the new normal moving forward. And really, this is also something, just handbooks in general, or the kind of interplay between handbooks and plan documents. Obviously, we specialize in self-funding here. So thinking about how these two documents interplay and really the roles that everybody plays in that puzzle, right? We have employees who are also participants. We have employers that are also plan sponsors. And then we've got TPAs that are involved as well, and kind of drawing the boundaries in terms of what does a handbook gap review mean in terms of, a TPA. They're not going to be administering many things from an employment perspective, but also the handbook is going to probably mention certainly things about eligibility for health plan coverage, things like that. All of those things can really be relevant, not just for the employees and the employers, but also TPAs and stop loss carriers, and really anybody else that's administering, benefits on behalf of that. So to kind of give a little bit more context, I'll throw it back to Kelly on, why this matters, not only just for employers and employees, but also for kind of other players in the game too.
Thanks, Kevin. I will say that I like to tell people when they ask if I work remotely that I like to tell them that I worked remote before it was cool, because I've been working remote
Yeah.
since 2014, which was obviously well before the pandemic. But you're
Yeah,
right.
the good old days of just, speakerphone phone calls and meetings, and
Oh
now
my
we've got
goodness.
video and everything, right?
Yeah, it kind of gives me a little PTSD. I mean, I feel like that is the one, I guess, advancement that has happened that has been for beneficial after COVID is the advancements in the abilities to work remotely and be more functional and more efficient. But it also adds that extra layer of complication with states expanding their leave laws and the paid leave laws or unpaid leave laws, whatever it is that they are. Every state is changing and they're changing rapidly. And if you have employees that are remote, it's going to add time and complexity to all of those things. But so for those of you who don't know, I did actually come from a TPA prior to being at FIA. So, like Kevin kind of alluded to, as a TPA, I understand that you do not want to address eligibility issues. It's generally very clear in the Administrative Services Agreement that the employer is responsible for notifying the TPA regarding all eligibility related issues and whatnot. So it can be a potentially scary concept to ask for an employer handbook to do this gap review, because you're realizing maybe you're opening some sort of door that you don't want to open, or maybe, like a Pandora's box type situation. But I think it's okay. I think as long as you set some clear boundaries and explain to the employer that this is why you're asking for it, you're asking for it with respect to the self-funded health plan to make sure that the documents align and that the plan is supported with respect to all those eligibility issues and leaves of absence and continuation of coverage, especially to protect them should stop loss become an issue related to certain claims and reimbursement. So, I don't think it puts any pressure on the TPA to do anything from like an administration perspective related to the employer stuff. It's just a way to gather more information and help support the plan. And I think that's kind of the message that TPAs can spin to their employer groups about why they're asking for it. It is truly to support the plan and make sure that the plan document is aligning with the employer policies that were probably in existence before the self-funded plan, or maybe they got born at the same time, but it's just a good double check to be proactive and get ahead of any potential issues. So, again, it might not be super relevant from a TPA perspective, but the gaps are important, and the gaps are going to impact you because it only takes one claim to really, blow up and become problematic for a group to lose faith and lose trust in the TPA or potentially other individuals that are helping guide them. If something goes wrong and it goes really wrong, you might lose that business. So it's better to ask for this and do those proactive gap reviews, ahead of time before it becomes an issue. So like I noted that this is a document review that we do as part of our ICE service. For if you're an ICE client, you get access to this. If you are not an ICE client, you can still get access to these reviews. We do them on an ad hoc basis. And just to kind of drive home what the deliverable looks like, there are technically two different deliverable options for the Handbook Gap Review. We do have a simplified version that is a report card review that really just looks like a report card, doesn't have a whole lot of details, just has a you're doing a great job or you're not doing a great job with like signified by, green check mark or red X. We also have a detail that we call it a full assessment and recommendation, so a FAR review, which is a very detailed analysis and provides that very detailed memorandum. So it can be 10 pages, it can be 20 pages. It just depends on how robust the plan document and handbook are, how many states the employer is located in. But we kind of do that analysis of here's what was in the plan document, here's what's in the handbook, and here's how they interact with each other. And if there's a specific state law requirement, like some sort of other leave of absence that maybe the employer overlooked, that would be something that we would note in there as an opportunity to improve their documents as well. So, again, we did this podcast by request because this was being asked about by some of our clients. And they said, this is a great time to remind everybody, especially with the landscape and the ever-changing landscape of where employees are located and remote work. And just the fact that, we are getting into some more strange times with now the peel back of all the COVID requirements and the national health emergency and the public health emergency ending. It's going to create some potential other changes related to the plan document and handbook. So this is a great time to take the time and do the reviews, do the proactive gap reviews, do a handbook gap review with them, do a plan document assessment, do a stop loss gap review. The possibilities are endless with the different types of document reviews that we offer. And we're here to help and support, our TPA clients, our stop loss clients, and potentially the employers that our clients service, as well as, we view them as our clients as well. So hopefully this was helpful to talk through this and to talk through why the service became a thing and why it's continued to be an ongoing service, because it is very relevant to what we do on a daily basis, even though at first glance it might not seem so. So thank you so much for joining Kevin and myself today for our podcast, and we look forward to talking to you in the future.
Catch you next time.